Your family history of diabetes isn't a sentence, but here's what it does mean. We're going to discuss genetic risk, family history, epigenetics, and early screening. I'm Dr. Kim, a board-certified naturopathic doctor who helps people uncover hidden insulin resistance. And if you're not sure whether insulin resistance could be affecting you, I've created a free 1-minute insulin resistance quiz. You'll find the link in the description below this video. Maybe your mother has type 2 diabetes, or your father, or a sibling. And somewhere along the way, someone told you you need to watch out. It runs in your family. And maybe that landed as a warning you've been carrying ever since. Like a sentence that's already been written and you're just waiting for it to arrive. I want to reframe that for you entirely today, because family history of type 2 diabetes is not a sentence. It is not a guarantee, and it does not mean your future is already decided. What it does mean, and this is critically important, is that your genetic blueprint may make you more susceptible to insulin resistance. And knowing that changes what you should be monitoring and when. Not to create fear, but to create an advantage. If family history is part of your picture, the 1-minute insulin resistance quiz is designed exactly for you. The link is in the description below. So, do you have a parent or sibling with type 2 diabetes? This is the only question on the quiz that isn't about how you feel or look. It's about your family, and that's intentional. Because first-degree family history of type 2 diabetes is one of the strongest known risk factors for developing insulin resistance yourself. Having a parent with type 2 diabetes roughly doubles your lifetime risk. Having 2 parents with type 2 diabetes can increase your risk by 3 to 4 times. A sibling with type 2 diabetes carries a similar weight. But here's what I want you to understand about those statistics. They're not about inevitability. They're about susceptibility. And susceptibility, when caught early, can be redirected. This is about your genetics versus your destiny. Let me explain what genetic risk for type 2 diabetes actually means, because it's almost universally misunderstood. Type 2 diabetes is not a single gene disorder. It's not like certain inherited diseases where carrying the gene means you'll almost certainly develop the disease. Type 2 diabetes is different. Type 2 diabetes does involve dozens of genetic variants, each one slightly increasing your susceptibility, interacting with environmental factors like diet, sleep, stress, movement, body compensation, and the metabolic environment you've lived in over your lifetime. The genetic piece determines how quickly your beta cells, the insulin-producing cells in your pancreas, can compensate when demand increases. People with a family history of type 2 diabetes often have a reduced beta cell reserve, meaning their pancreas has less capacity to compensate for increasing insulin resistance before blood sugar starts to rise. But the key word is compensate. Insulin resistance has to be present first. The genetic vulnerability doesn't cause insulin resistance by itself. Instead, genetics can often cause insulin resistance to progress faster once it begins. But lifestyle and environmental factors usually pull the trigger. This means that if you have a family history of type 2 diabetes and you identify insulin resistance early, before beta cell compensation starts to fail, you have the opportunity to intervene in a way that changes the trajectory entirely. The gene may have loaded the gun, but lifestyle and metabolic environment determines whether it fires. And the earlier you know the gun is loaded, the more options you have. Here's what family history of type 2 diabetes should change about your monitoring. And this is the practical heart of this video. If you have a first-degree relative with type 2 diabetes, you should not be waiting until your fasting blood glucose hits 100 milligrams per deciliter before anyone starts paying attention. You should be monitoring your fasting insulin now while blood glucose is still normal to catch the compensatory hyperinsulinemia. And all this means is your pancreas is making extra insulin to keep your blood sugar normal. And this happens years before blood sugar rises. Because blood sugar is the last number to change. Fasting insulin rises first, HOMA-IR climbs while blood glucose still looks textbook normal. And if you have a genetic susceptibility that limits how long your beta cells can compensate, the window between elevated insulin and elevated blood sugar may be shorter for you than someone without that family history. Early monitoring is not about anxiety, it's about advantage. Catching elevated fasting insulin and a HOMA-IR of 2.5 while blood sugar is 88 is a very different intervention conversation than catching it when fasting glucose is 112 when the standard system finally flags it. On the functional medicine side, we check function, and family history is the reason to check function earlier and more consistently than standard medicine recommends. I want to spend a few minutes now on epigenetics, because this is where the conversation shifts from what you inherited to what you can actually influence. Epigenetics is the study of how environmental factors affect lifestyle, including toxin exposure, which in turn affect which genes get expressed and how strongly. You can't change your DNA, but you can change which parts of your DNA are turned on or turned off, and by how much. The research on epigenetic modification of type 2 diabetes risk is genuinely encouraging. Lifestyle interventions, particularly reducing refined carbohydrates, improving sleep, and adding resistance exercise, and reducing chronic stress, have been shown to modify expression of genes associated with insulin resistance and beta cell function. The Diabetes Prevention Program, which is one of the largest and most well-designed studies in this area, showed that intensive lifestyle intervention reduced progression of type 2 diabetes by 58% in high-risk individuals, more effective than the drug metformin, and the benefits were more pronounced in people over 60, meaning it's never too late for this to matter. You may have inherited a susceptibility, but you did not inherit a certainty. And the interventions that reduce that risk are the same ones that address insulin resistance across the board, which is exactly what this channel teaches. Now there is an emotional piece, and I want to take a moment here for something that doesn't get talked about enough in clinical conversation about family history. Watching a parent or a sibling live with type 2 diabetes carries a weight. You've watched what the disease does. You've watched the medications, the complications, and the limitations. And you may carry a fear, sometimes quietly and sometimes loudly, that the same thing is coming for you. That fear is understandable, but it can lead you in two different directions, either toward vigilant attention and early action, or toward avoidance, because not knowing feels safer than finding out something bad. If you've been avoiding the conversation because the family history feels like too heavy of a subject, I understand, and I want to offer you a different frame. Checking your insulin, fasting, when your blood glucose is still normal, is not finding out that you have diabetes. It's finding out that you have time time to intervene, time to change the trajectory, to do for yourself what may not have been known or available when your parent or sibling was your age. Knowledge at this stage is not a threat, it's a tool. And that's why question number 6 is on the quiz. If family history is part of your picture, especially if it's showing up alongside other symptoms on the 1-minute insulin resistance quiz, family history combined with even 3 or 4 other yes and answers on the quiz tells me and you we need to look at fasting insulin and HOMA-IR sooner than later. I respond personally to every score when you send me an email. The link is in the description below this video. So now what can you do? First, get a fasting insulin level blood test now, not later. This channel is all about knowing your numbers. My fasting insulin on July 8th, 2026 was 6.1, and my fasting glucose on the same day was 95. That puts my HOMA-IR at 1.3. This is an excellent result. 1.0 to 1.9 is great insulin sensitivity. Can you tell me your HOMA-IR? Post your number in the comments below. If you have a parent or sibling with type 2 diabetes and you've never had a fasting insulin level checked, that is the single most important thing I want you to do after this video. Get a fasting glucose and a fasting insulin blood test. Ask for these blood tests specifically from your doctor. Second, know your HOMA-IR. The way to calculate HOMA-IR is to take your fasting glucose number times fasting insulin number and divide them by 405, and this equals your HOMA-IR. Get fasting insulin and fasting blood glucose tests on the same day draw and calculate your HOMA-IR. If it's above 2.0, even with normal blood glucose, that is an actionable information. This is an early signal worth addressing while the window is open. Third, don't wait for symptoms to become obvious. With a family history, the standard screening schedule isn't early enough. Functional medicine recommends checking fasting insulin starting in your 30s or earlier if symptoms are present. Annual monitoring gives you a trend that's far more informative than a single snapshot. Fourth, take the quiz. Your score combined with your family history gives you a much more complete picture. We didn't choose our family history, but you and I get to choose what we do with the information it gives each of us. And what the information gives you is this: pay attention earlier. Check the right numbers sooner. Don't wait for a blood sugar number to cross a threshold before anyone starts looking at fasting insulin. The people I've worked with over the years who have the best outcomes are not the ones with the best genetics. They're the ones who found out early and took it seriously. They know their fasting insulin and their HOMA-IR before anyone ever mentioned the word prediabetes. And this can be you. Next up in the Foundation series is, could insulin resistance be causing your PCOS or hormone symptoms? We'll answer that in the next video. If this video helped you, take my free 1-minute insulin resistance quiz. Just click the link in the description, enter your email, and you'll get immediate access to the quiz. If you want to better understand your symptoms, your lab work, and solutions that can help you improve your metabolic health, subscribe so you don't miss my next video. Know your numbers, change your future. Until next time,